My name is Melanie Langille. I'm the President and CEO of NB Lung, and it is our great pleasure to be here in St. Andrews this evening doing an information session on radon. We were doing a community testing drive here in St. Andrews, and we had scheduled to do this information session a little bit earlier, but there was so many people here to pick up radon testing kits that we had to postpone later, so thank you for tuning in and watching afterwards. Let's get rolling here. Before I start any presentation, I'd like to take a moment and just recognize that the land that we're on here is the traditional and unceded territories of the Passamaquoddy, Wolastoqey, and Mi'kmaq nations. And we pay respect to the elders, past and present, and the descendants of this land. We honor the knowledge keepers and welcome their guidance as we strive to develop closer relationships with Indigenous peoples in this province and the connection between our land and our health. I also wanted to say a huge thank you to the town of St. Andrews for having us, and for the individuals who came out en masse this evening to pick up radon test kits to understand the potential risk to them of this radon gas in their home. And also equally thank you to Health Canada for providing test kits for up to 400 homes in this community. It's just amazing. So who are we? Who is NB Lung? We are a registered charity. We've been serving New Brunswickers since 1933, which makes us one of the province's oldest charities. Our team is about 11 staff and a 10-member board of directors. You may be more familiar with our logos over time. You can see the progression here recently with this new look. We are an independent entity. We're devoted entirely to New Brunswick lung health priorities, working towards a vision of all people free of lung disease. We work in areas of patient support, illness prevention, which includes immunization and environmental health threats, which is what we're going to talk about tonight, and we work in the areas of advocacy and research as well. So what is radon? Radon is a serious lung cancer risk. I want to start by sharing a story. On the screen here, this is Angela Stiefly. She just turned 58 this past year. She's health conscious, non-smoker, she's physically active. She is a physiotherapist. There's no family history of lung cancer. And Angela was diagnosed with stage 4 lung cancer recently. Her prognosis is not good. And when she went in and started doing some research about how could this happen, she learned about radon and had her home tested, and it was very, very high. Radon is a naturally occurring radioactive gas. You can't see it, you can't taste it, you can't smell it, and it comes from the breakdown of uranium-based bedrock. It's found in all soil, water, rock, and in gas form, it can escape from the rocks. It gets diluted in outdoor air very quickly. It's not a concern there, but in enclosed spaces like our homes, it can become trapped inside the home, accumulate, and that's when it becomes a serious health risk. So radon is not just a gas. As it breaks down, it actually turns into solids. So inside your lungs, this chemical reaction is happening and is breaking down into little particles that continue to emit radiation over time. This damages your lungs and can lead to lung cancer. Kind of interesting that radon was discovered actually in Canada in 1899 at McGill University by Ernst Rutherford and Harriet Brooks. Thank you to those folks. And then it was 1988 before the World Health Organization recognized and classified radon as a group 1 carcinogen, as it has well-established links to lung cancer. We're talking about radon here in New Brunswick. Here is a map that has, basically by health region. This is based on a study by Health Canada that was done in 2012 of about 1,200 homes in our province. And this shows the percentage of homes that were tested at that time that exceed the action level set by Health Canada. So you can see it varies across the province from anywhere from 10 and a bit percent to as much as almost 40. So Health Canada identifies New Brunswick as having some of the highest radon levels in all of Canada. Why? It's nobody's fault. Our area of the country is underlain by bedrock that is very high in uranium. And during the last ice age, the glaciers came through, and as they made their way out to the ocean, they scraped off all of our overburden. So we don't have very much soil between us and the bedrock. And I've got a link here to the bedrock geology surface map, which I've put up here. You can see there's a number of areas. You see these pockets of these areas of high radon in our uranium-based rock in our province. And so those are the areas that we tend to try and go in and do some intense testing. But just because the geology says that there's a high risk, just because the geology says there's a low risk, doesn't mean there's necessarily no risk. And so it's super important to test your home for radon, because our statistical data shows that depending on which data set we're looking at, it's anywhere from 1 in 4 to 1 in 5 houses in New Brunswick have unsafe levels of radon. Now, lung cancer is the leading cause of cancer in New Brunswick. Almost half the people diagnosed with lung cancer are not diagnosed until the cancer is at stage 4. And by that point, the 5-year survival rate's below 5%. Lung cancer accounts for more cancer-related deaths than the next three leading cancers combined. So it's prostate, breast, and colorectal combined. So it's the #1 cause of cancer deaths in New Brunswick. So what are the risk factors for developing lung cancer based on radon exposure? It all depends on how much radon is in your home, how long are you exposed for in hours per day or number of years, and really every exposure to carcinogens increases your risk over time of developing cancer. Excuse me. So the only known health effect from exposure to radon is the increased risk of developing lung cancer. Radon is the second leading cause of lung cancer in people who smoke and the #1 case in non-smokers. According to Health Canada, the lung cancer risk for a non-smoker with a lifetime exposure to radon at 800 becquerels per cubic meter is 1 in 20, and the risk to smokers is even higher. This is a map of cancer prevalence across Canada, and you'll notice that it's higher in the Atlantic provinces than the rest of our country. So again, based on our studies, more than 1 in 5 homes in New Brunswick have unsafe levels of radon. But how does it get into your house? So this is an image that shows a house here, which is an enclosed space. We've got a source of contamination. This model can be applied to lots of different situations, but we're talking about radon here. And the building actually has a zone of influence around it that affects the amount of air that goes from the house into the soil and from the soil into the house. There are a number of ways, a number of pathways that the gas can move from the soil into your house. Generally with a poured slab foundation, we understand that there's, at the very minimum, a crack around the perimeter of the house. And then every time we are putting penetrations through that foundation for pipes, for sump pits, and those sorts of things, we're introducing other areas that are potential pathways for that gas to move in. We also find that the more energy efficient homes really mean that some of those pathways for the gas to get out have become sealed up. So we find that more energy efficient homes have more radon trapped inside. Who's at risk? Everybody. Radon is in all buildings, whether you have an old home, new home, it's energy efficient or it's very drafty. It's there in some level, but the question's how much? The only way to know how much is in your home is to test it. But testing is easy, and high radon levels is fixable. Best way to test a home for radon is using a CNRPP certified long-term testing device, which is what we have supplied to over 400 individuals here in St. Andrews this evening. Those test kits need to be deployed or put out into the space in your home to collect data over a period of at least 90 days because the levels of radon can fluctuate within your house during the day and from day to day. So we want to have as big a window, this nice long window of time so that we can understand when we back calculate from a day-to-day basis what you would be exposed to on average. Because in this part of the world we close up our houses in the wintertime, we don't go in and out quite as often, we don't have our windows open like we do in the summertime, Health Canada recommends that we do this testing during the heating season. Because we do keep them closed up. So that's why we're here. It's early February. We know that we can get that 90-day test in during a period of time when our houses are generally going to be closed up. You want to put your testing device in the lowest level of your home that you spend at least 4 hours a day. So for some folks, this is going to be a basement. For some folks, this will be on the main level of the house. You want to find a flat surface in the area of your house that is the lowest level that you live in, like a desk or a table. Some people use a bookshelf, or you can even pin them to the wall. But you want to choose a room that doesn't have really high humidity. So avoid putting your detector in your bathroom or your kitchen or your laundry room. Then you want to leave it undisturbed during the testing period. You don't want it to be in an area with direct sunlight. Pardon me, we don't want to have it in a bathroom, kitchen, laundry room, or furnace room. That's one that I had omitted before, sorry. And after 90 days has passed, then you are ready to send your detector to the lab. And so we will be doing a community gathering of those test kits, and we'll take care of getting them to the lab for you. This is a picture that I really love. And thank you to our friends at RPC Laboratory for providing this picture. So what happens as radon gas breaks down is it emits particles and energy as this radioactivity happens. And that energy, as it's breaking down, actually pings or makes little dents in the plastic that's inside your detector. So this is literally an image from a microscope looking at the plastic film inside an alpha track detector. And we put a green filter on it so it's a little bit easier to see. The contrast is a little bit better. But each mark on here is a dent in plastic caused by radioactive decay. Now imagine that happening inside your lungs. So alpha particles are not overly energetic. A piece of paper can stop that energy from passing through, but our lungs are not as strong as a piece of paper. Just to summarize again, the St. Andrews Community Testing Drive, we had test kits for up to 400 homes in St. Andrews. Some of you may have, when you came to collect your kits, gotten 2 kits, and that's for a quality control measure. Every so many test kits that the lab tests, they actually do it in duplicate so that they can compare one to the other, knowing that they should be about the same. That allows them to continue to calibrate their instruments and keep that proper. So we'll be back in town. We'll wait more than 90 days. Obviously some of you may have things going on in your life today, tomorrow, the next day that may keep you from getting that detector out of its plastic case and up where it's going to be doing its testing. So we'll give it a bit of a buffer, and we'll come back and collect them. Once the lab has done the analysis, you will get your own individual result. And the town is going to get a town-level aggregated data. So the town is not going to know that the concentration of radon at 123 Main Street is 400 becquerels per cubic meter, but they will know, on average, what the level is in this town. When you get your result back, if your result is above 200 becquerels per cubic meter, this is when we need to be taking the radon levels really seriously. The higher the level, the sooner corrective measures should be taken. We like to say that having high radon test results doesn't make your home less valuable. And in fact, we're seeing more and more people that are asking, when they're purchasing a home, they want to know what the radon level is in the house. If you've tested and you're below 200 becquerels per cubic meter, that's great. If you've tested and you're above 200 becquerels per cubic meter, you may want to look towards some mitigation devices. So mitigation means reducing radon in your home. The Health Canada guideline for radon is 200 becquerels per cubic meter. And if the long-term results exceed that level, that's when we recommend that a CNRPP certified radon professional comes into your home and gives you a bit of an idea of what you can do to reduce the level based on your concentration and what the situation is like in your home. It's important to know that techniques to lower radon levels are effective, and they can save lives. So we know that these radon mitigation measures can reduce radon by as much as 80% in as little as 24 hours. So I've got a demonstration model over here. So if you do have high radon levels and you are looking to have some mitigation work done, this is what you can expect the average house to require to evict that radon from beneath the slab and ventilate it outside. So it's simply a pipe, a fan here, and then this part goes outside your house so that radon doesn't come in, it just goes out to the outside here. On average, it takes a contractor about a day to do this type of work. And the cost depends on so many factors, but on average, based on the number of mitigators that we have talked to, somewhere in the ballpark of $2,500 to $4,000, depending on, again, on those factors in the house. There are 8 certified radon mitigators in our province right now. There's the link to find them, but that's the Canadian National Radon Proficiency Program. And they are also listed on the Canadian Association of Radon Scientists and Technologists website and listed on Health Canada's website as well. So us at MB Lung, we are doing this awareness campaign about radon, and I just wanted to take a moment to say, help us do more. Here's a picture of Angela after she had been in the hospital receiving treatment for her lung cancer. And we have developed a community fund and asking all communities across New Brunswick to help support our efforts to raise awareness on the dangers of radon and help mitigate the homes that need it. So we've created Angela's Allies. It's a community fund. So New Brunswick can join together and put a stop to this preventable cause of lung cancer. At MB Lung, we raise awareness about radon in a couple of different ways. So community sessions like this, which are so exciting. We have a new program starting very soon where we have electronic radon screening, lending kits in libraries and other public venues across the province. So these are not your gold standard 90+ day analytical test, but it's more like a pulse read of what the radon levels are in your home over a shorter period, 3 or 4 weeks, depending on what the library's capacity is. We are also doing, providing long-term testing to those that are in financial need. You know, if you can't afford to buy one of those long-term kits on your own, or you're not part of a community like this that has had the opportunity to have Health Canada come in and provide them to you, give us a call, we can help you out. The data we collect from community testing drives like this and other testing across the province, even if it's not as highly concentrated as this, helps us to inform our advocacy and advocate for government supports for testing and mitigation of this preventable cause of lung cancer in our province. So we ask that everybody that is here tonight, or was here tonight, keeps Angela's legacy going. Know that this program is made possible through support from Health Canada and from public contributions to the Angela's Allies Community Fund. We're deeply grateful to our donors and your unwavering patronage. Without each of you, this type of work would not be possible. So a huge thank you from the team at MB Lung for having us into your community here and helping us spread Angela's story. At this point, I would ask for any questions, but as we're doing this as recorded afterward, you can absolutely pop us any questions by email at info@mblung.ca. You can give us a call at 506-455-8961. Option 3 will get you to the person that is well-versed in radon. So we want to keep talking about radon. We talk about it on every social media of choice, every social media platform out there. Choose the one that you want to follow us on, and we're always talking about radon. So again, a big thank you to our partners, Health Canada, Town of St. Andrews, Radon Plus, who is here tonight and provided this great model of a radon mitigation system. RPC Lab was here also with a demonstration about helping to visualize those particles and the emissions, or that activity in the air. And to my team at MBLung for putting this on.